Okay guys, so yesterday I told you I was going to do a little video about skinny jabs. Okay, I've done this about 4 times. My first one was 17 minutes, my last one was 11 minutes. I'm trying to bring it down so I don't bore you to death. Okay, but it's kind of important that you know all the details regards this so you can make informed decisions yourself. You know, I don't want anyone going into this going in and using this because the girl at the beauty salon's lost a load of weight on it without you knowing exactly what you're doing with it. Okay, so it's a GLP-1, which is a hormone that is in your small intestine, and when you eat, then it sort of ramps that up. Okay, so basically you're just giving yourself a little bit of extra, which is going to help with enhancing insulin secretion. Okay, insulin is the hormone that shuttles nutrients around your body. Okay, most of us, well, not most of us, but a lot of us in the UK and in kind of the Western world, we have what's called insulin resistance. Okay, and that's just because we have food on tap, don't we? And we overeat a lot. Okay, so basically what this does is it helps that system out, so your body's getting all the nutrients it needs rather than those nutrients sitting in your bloodstream and making you feel sluggish and lethargic. So what else does it do? It helps suppress glucagon, okay, which is really helpful for people with diabetes. Basically, glucagon is glucose, blood sugars that are stored in your liver, okay, and they're kind of there for emergencies. So when your body is stressed, okay, whether that's you're stressed because of daily life stuff, or you're stressed through exercise, your body will start pumping this, or your liver will start pumping this out, raising your blood sugars again. Okay, and that helps it keep it nice and low and doesn't pump it out as much. Okay, the main benefit of liraglutide is the appetite suppression that it gives you. Okay, it helps us sort of keep a lid on our appetite so we're not overeating, and it helps us get ourselves into a calorie deficit and lose weight. So the first thing that it does is it slows down gastric emptying. Okay, gastric emptying is the rate that the food moves through your stomach and into your intestines and stuff. Okay, and doing that helps us feel fuller for longer. Okay, helping us reduce our appetite. Okay, it also has an effect in the brain. Okay, which slows down our need for food. Okay, so we don't get a lot of cravings when using liraglutide, which obviously helps us stay in a calorie deficit and losing weight. Okay, so I wanted to tell you about some contraindications. Okay, so reasons why you shouldn't be taking liraglutide. Okay, so if you've got problems with your thyroid, or you've got family history of issues with thyroid, then you need to speak to your doctor before taking this. Okay, there are some thyroid issues that can be not so much helped, but be better if with taking this, but there are some that can make you quite ill. Okay, so make sure that you spoke with your doctor if you have any thyroid issues or family history of thyroid issues. Okay, if you've ever had pancreatitis, okay, it's definitely worth caution. Okay, and again, speak to your doctor before you try this. If you've got any gastrointestinal diseases, such as Crohn's disease or irritable bowel syndrome, then it might not be recommended. Okay, this is due to the effect on gastric emptying. Okay, it might make you ill. Not in all cases, but speak to your doctor about it. He'll be able to give you a lot more information than I can in this video. If you're planning on getting pregnant or breastfeeding, don't do it. Okay, it can have effects on the fetus. Okay, also if you have any allergies, okay, please check the packet before you take it, because obviously injecting stuff into your body that you're allergic to is going to cause some nasty reactions. Okay, Tony asked me about its uses in type 2 diabetes. This drug was developed for the treatment of type 2 diabetes. Okay, so as I mentioned before, it increases insulin secretion. Okay, which is going to help you improve your type 2 your blood sugar control. Also, it really helps with bringing your HbA1c down, okay, which, if you don't know, is the sort of the main, the gold standard, the recording of how you're managing diabetes. Okay, it's also really beneficial for weight loss, as we've just alluded to, and diabetes, type 2 diabetes, is a lot to do with being overweight, obese, and having eating poor quality foods. Okay, so yeah, it can be massively beneficial there. It also has some improvements, or shown some improvements in trials, in cardiovascular benefits. Okay, so you may feel a little bit fitter taking this. Okay, you'll be able to train at higher intensity because of it. One thing you may notice as well is your heart rate will be a little bit higher. Okay, not drastically, but you know, if normally when you're doing a HIIT class you're in the yellow zone, it might bump you up to the red. Okay, but don't just take it for that reason. Remember, the MEPs are my zone. You get 4 points whether you're in the yellow or the red zone. Okay, so always try and stay in the yellow zone. It's a better way forward. Okay, looking at this long term. Okay, liraglutide was developed to be a lifelong medication. Okay, so if you can't get it prescribed by a doctor, you're going to be having to pay for it, and it can be quite expensive. So, you know, if you're going to take it and you can only afford to do it in a short term, okay, something you're going to need to work on is your habits. Okay, your habits around nutrition, your habits around sleep, okay, that are going to help affect your appetite. Okay, so eating more vegetables, more protein, getting enough sleep, okay, they're going to help you massively. Because when you discontinue, when you stop taking liraglutide, your appetite's going to come back. Okay, and in some people it comes back even more elevated than it was in the first place. Okay, so yes, you're going to be able to get the weight down really, really well while you're taking it. Okay, but it's going to be difficult to keep it off when you discontinue it. Okay, if anyone's got any questions, feel free to drop me a message, DM, or comment below this post, and I'll try and guide you and answer any questions that you've got. Cheers, guys.